information about cannabis, especially when it comes to the two of the plant's well-known compounds, THC and CBD. Hello, I'm Cheryl Yamamoto. I'm here with Pineapple Life Studios for this edition of Pineapple Nation. So we'll be talking a little bit about some of the benefits of THC and CBD and some of the different uses of THC and CBD. So I'll just get started with a little bit of information about both. THC is best known for delivering the psychoactive effect or the high, but it's also responsible for pain relief, making it ideal for medical purposes. CBD is the non-psychoactive, so no high. It even works to stop the effects of THC, so it even works more than not providing any high, but it also stops the THC from binding to the receptors, which will lessen any sort of high or psychoactive feeling that you would get from taking a CBD. So it also, CBD has a major effect. It's a positive effect on your immune system. This also helps with like anxiety, depression. It can even slow cancer progression. So very important to know the difference between CBD and THC. They're completely different things, completely different ballgame. So the two important chemicals, they're very different, but they still impact our body's natural biological pathway, which is an upload system called the endocannabinoid system. And this system is what regulates our mood, our appetite, our memory, pain, things like that. It's a natural occurring system in our body, and this is what regulates, pain, anxiety, also inflammation and things of that sort. So it all starts with the receptors that are responsible for this, which are our CB1 and CB2 receptors. First off, with CBD and THC being completely different, I'll explain sort of CBD. It's designed to give you all of the positive plant effects without the high that you would feel from THC. So with your body's endocannabinoid receptors, and this is again a neurotransmitters that bind to the cannabinoid receptors. Without getting too scientific here, I want to try to make this information come across where it's digestible and you can understand it, but you do kind of need to understand how your body even processes CBD or THC, and it's all done through the CB1 and CB2 receptors of these are natural receptors that our endocannabinoid system has already in our body. And so these are expressed through our central nervous system. So the CB1 receptors, directly affect your immune system. The CB1 receptors directly affect your brain and nervous system. The CB2 receptors directly affect your immune system and inflammation in the body. But to be clear, CBD doesn't actually affect the system directly. What it does is it stimulates the production of our body's natural endocannabinoids and slightly changes the structure. And this allows your body to create more. So CBD directly stimulates the CB1 receptor by binding with it, and that's why you get the effect of the nervous system, like feeling relaxed or pain relief. THC affects the CB1 receptors by binding to it and making you feel high or psychoactive. You feel that nervous system response immediately because it is targeting the CB1 receptors. So the CB2 receptors directly affecting the immune system and inflammation, the CBD oil makes it more responsive. It changes the structure and allows in more of the compounds that make you feel better, relaxed, or an overall sense of well-being, by making the structure more receptive to the CBD. So in the same time, it's also blocking out the effects of THC. The CBD receptors will affect the immune system and lower inflammation rate without any psychoactive effects or feeling high, because it's changing the structure of your receptors, and it's not making you high. So the THC does. CBD can actually stop that effect. It's stimulating your body's natural ability to fight the inflammation response and relieve pain, anxiety, seizures, insomnia. So we get into a little bit of what are our other options? What are the other alternatives? Well, pharmaceuticals, and we all know what problems that causes. So of course you're going to get immediate relief from pharmaceuticals, but it's not natural. These are chemical structures, and it causes all sorts of problems to your body's organ system, all the systems of your bodies, because of all of the debris and toxicity that has to filter through the kidney and liver to get those relief, or that relief. All sorts of pharmaceutical medications can be replaced safely by the use of CBD. Once you understand how it works on the receptors of the endocannabinoid system of the body, you'll understand that it can do so without any toxicity. So to give you an example, even taking vitamins, like a vitamin C, for example, there's a little bit of filtering that still has to go through your liver and kidneys because it has to filter through the body. But with a CBD supplement, there's no filtration system that happens. There's no toxicity because our body already has the endocannabinoid system and receptors there to receive it, to get all the benefits of plants. It's a plant. So plant medicine is so huge, because especially CBDs in particular, because there's no toxicity that goes through the body. Why would you not pick something that is going to give you zero toxicity over something that's going to hurt your organ systems in the future and make you addicted to it on top of that? So there's no addiction that happens here. It doesn't stimulate that part of the brain. And you might like the effects of feeling better. Who wouldn't? And if you're going to feel better without having any toxicity to your body, I don't see why you wouldn't. So I do understand that there's a lot of misconceptions and discord around CBD, thinking that it's the same as THC, when actually it's not at all. The only similarity is that they both come from a plant, but they're completely different in the way that they affect the body. And CBD should not get grouped in with THC at all. It actually doesn't have anything to do with THC, and it actually stops the effect of THC. So it is not pot, it's not THC, it's not going to get you high. So for those of you who don't like that psychoactive feeling, and that's not what you're going for, you can still get a lot of health benefits of CBD. So THC does also provide a lot of medical benefits as well, because it works on different receptor, more so of pain and of your nervous system. So you're just going to feel instantly better. But some people can't handle the psychoactive effects of THC because it can cause some paranoia. It can, if it's too strong or too much and the person isn't used to it, it can cause a lot of bad side effects. So if you still are looking to get the benefit of CBD and THC, you can start with, there's all sorts of different strains that have either higher THC, less CBD, or vice versa, higher CBD and less THC. I get asked the question all the time, what supplements do I take? And I'm super picky about my supplements in general. They have to be organic and they have to be non-GMO. But I've tried every CBD product out there, and I do have my favorites. CBD gel or cream is what I go to. Not currently at the moment, I'm not teaching as much, but I normally teach a lot of physical practices, yoga, bar, kettle, and aerial yoga, and teaching, 4 to 5 classes a day, 7 days a week for years. I don't get the natural aches and pains that I think I would get if I hadn't been using CBD oil. I'm telling you, it helps with pain, inflammation, it helps with insomnia, it also helps with anxiety, so many things. And I've been using CBD regularly for a couple years now. Highly recommend it, just highly recommend it. It's what I tell people to take if they ask me what they should take for anti-inflammatory, along with the supplement turmeric, which is also very good for anti-inflammatory. But that's a whole nother topic. I take so many supplements. There's just a huge long list, and I take them every day. But for CBDs, the one that I like right now that's helped me sleep at night also adds melatonin. So the particular one that I've been trying right now is this CBD FX. So it's just gummies. You can buy them online. They're vegan, non-GMO, broad spectrum CBD plant. So they're very healthy, they're good for you. But these particular ones have melatonin, and again, I like that combination for nighttime. There's also all sorts of ways to take CBD supplements. There is a tincture that you can put under your tongue. There is gummies, candies that you can take and ingest. Ingestion works best. It takes a while to work. You feel the effects about 40 minutes after you take it. With the tincture, you're going to feel the effects a lot faster, but they won't last as long. So I prefer gummies, eating them or ingesting it. If you don't want the sugar that comes with gummies, you can just take a CBD liquid pill, which has like fractionated coconut oil or some sort of carrier system. It needs oil or some sort of system to carry into your body. So there's also topical. So the gel I talked about. Now I like a gel that's called Sunset CBD. It's a 500 milligram. It's really strong, and I've tried almost every gel product that there is out there that's CBD, and I found that one works the best for me. Live Green Hemp also has a 250 milligram CBD gel. This is a pain gel. It's not a regular lotion. It actually has a menthol base so that you'll feel pain relief right away. I always recommend that. But you just want to try out different products and see which one works for you, and you'll have to order them online. Any shop that you would go to, at least in Washington, any cannabis shop, you're going to get THC in your CBD product. There is always a little bit of it. So if you do not want any THC, I recommend ordering the CBDs online so that you can get 100% CBD product. Also be careful, like if you're on Amazon or other places and it says hemp, that is not the same as CBD. It is, but it isn't. So hemp is different, and this is how they're able to sell it on there. CBD is not federally regulated. Cannabis rather is not federally regulated. It's going to be regulated per state, depending on the state that you're in. So you will still get a little bit of the THC, although remember, taking a CBD product will help to block the THC effect, but there will still be a little bit of an effect. So I encourage you to just try other options if that doesn't work for you. So please comment. Let me know if you have any specific questions on the uses of THC or CBD. Any scientific data that you would like me to post, I can post links, references. There's tons of peer-reviewed scientific journals studies that are coming out now on the benefits of CBD and THC. Of course, CBD is it's newer. We have a lot of studies on THC, but not as many on the effects of CBD. So clearly, I've always thought that Big Pharma, they don't want CBDs to come out. They don't want you to be off of your prescription medication that you are a slave to taking every single day, because that is how they make their money. And just being honest, CBD, it's so much more natural. Any benefit that you can get from a naturally occurring plant with zero toxicity to your body is going to be better than taking any pharmaceutical, in my opinion. But that's just my opinion. I encourage you to talk with your doctor. They may not have much information about CBD or THC. They're not trained in it. Hopefully, if you have a naturopathy or a doctor that's open to at least looking into the science that is being presented, they will help to give you more information. But sometimes you just have to turn to the internet, and you have to turn to other sources to get your information. But do try it and see if it works for you. They give CBDs to children that have seizures, epilepsy, and it is so much better for them to take CBD to completely get rid of their seizures and epilepsy than all of the massive amounts of medication they have them on that just hurts them, makes them addicted. All sorts of neurological and psychological issues that happen with taking those type of medication as a child. So please consider a CBD option as a more natural and healthy option. And again, comment if you have any questions or concerns that I might be able to help you with. And happy 420!